Welcome to Pharmative Live, and we're coming to you live from Palm Springs, California. And my name is Dr. James Partyka. I'm an oncology research scientist, clinical pharmacist, and the founder of Pharmative. And Pharmative is all about providing you with practical healthcare information so that you and your family can make informed decisions with your healthcare team, your pharmacists, your doctors, and your nurses. And we come live to you here on Sunday morning. I always say, eat some pancakes, say a prayer, and love Pharmative Live every Sunday morning at 10:55 a.m. Today we're going to be talking about crushing the COVID-19 virus. This is part 4. And before we do that, I'd like to talk about Pharmative as our sponsor of Pharmative Live and Pharmative.com, which you can join for free today. Just go to the website, Pharmative.com, and hit the pink bar at the top of the page. You can read information about Pharmative. Pharmative does not accept any paid advertisements from pharmaceutical companies, biotech companies, and Pharmative Live is brought to you as a way of giving back to society to provide, again, practical information that you may or may not read or hear about in the lay press. So again, that's Pharmative Live. We'd like to provide tactical knowledge, tactical information to you coming here live from Palm Springs, California. And all of our Pharmative Live videos are available on our YouTube page as a playback, as well as on our Pharmative.com Pharmative Live page. So let me just give you a brief tour of Pharmative. If on your tablet or your laptop, you go to Pharmative.com, the only information you are required to enter is establish a username, enter a valid email, establish a password, go back to your email inbox and confirm your email address, and then you're good to go. Go to Pharmative.com, sign in with your username and password, and if you'd like to, you can update your profile with your interests, some basic information, as well as your photo. And then what I'd like you to do as a member of Pharmative is go to the upper right-hand corner on your tablet, on your phone, your smart device, or on your laptop, and select Find and Join Networks. And when you do that, a menu of all the different channel networks that we have on Pharmative.com will come up. We have 15. And they're all on various topics. One of my favorites is a virtual pharmacy on medical information. So you'll learn a lot of information about medications. In addition to that one, we have, and again, if you go to the icon, the logo for Pharmative, it'll take you right back to your profile page. You'll also find, again, I'm selecting, on the main menu, Find and Join Networks. We have one on animal health called Animal Kingdom. Take Charge, which is, again, taking charge of your healthcare for you and your family members. We have an addiction channel. So important today to understand that addictions are diseases and they need to be treated as such. So there's information about that. There's a healthcare channel for women called Trending Pink, a healthcare channel for men called Trending Blue. There's a cancer channel. There's a channel for senior living, senior citizens, and a number of other ones, including one called In Tech, which is technology and healthcare. So you read up on those channels through the menu, and then if you find that interesting, you join that channel network. And then automatically the information will start populating your trending feed. And that's Pharmative.com. All the information that is written and edited and produced by Pharmative is either labeled as Pharmative or Pharmative Care Team. And that information is all locked down, so you can't change it. But you can comment on it, like you comment on things on Facebook or Twitter or Instagram. You can comment. You can also use our instant messenger, which is encrypted and HIPAA compliant. So those friends in your network that you're connected to, you can instant message them about anything regarding healthcare or other matters, and be assured that from point to point, that information is encrypted and our messenger is HIPAA compliant. And that's Pharmative. It's the first social media network dedicated to healthcare and fitness, and it's provided to you free of charge. So check that out. We're also on YouTube as well. All of our videos that we've produced for the past several years are also available on YouTube as well. And then there's a channel network here called Pharmative Lives, which is all of our live videos that we produce on a regular basis. And you can also retrieve that information on demand anytime, 24/7. So that's Pharmative.com. And now we're going to be talking about COVID-19 and crushing the virus. And I've kind of divided up this brief 15-minute talk into 5-minute segments. The first is going to be on an interesting waste treatment study that was conducted in Palm Springs, but similar studies have been also conducted in major cities like Boston. The second will be on a concept called herd immunity, which I think is important for us all to understand. You'll be hearing more about herd immunity in the lay press, and it's oftentimes misused, but it's an easy to understand concept, so stay tuned for that. And the third thing we're going to be talking about is the new Pfizer BioNTech vaccine, which is now available, that will protect you against COVID-19. Now available 2 days ago for national emergency use in the United States. So that'll be our last segment. So anyways, let's begin with the first one, which this was a study that was recently published just a couple of days ago. And it's a wastewater study. Now, it turns out those patients that are infected with COVID-19 shed the virus in their stools. And when they go to the bathroom and they flush the toilet, that virus goes into the sewage system. And scientists can sample the sewage water prior to being treated in a water treatment facility. And this was done in Palm Springs. And if you go to our online magazine, the feature article this week is on this particular study, which will provide you more information. Was done in Palm Springs. And they sample the water, the sewage water, over time. And in this particular study, they looked at the time of November, right before Thanksgiving, and then right after Thanksgiving. And what they're looking for is a huge spike in the viral load, which is predictive of disease in the community. So, just reading my notes here so I get the numbers correct. On December 7th of this year, there was an increase of 700% of viral load of COVID-19 in the sewage water in Palm Springs. Now, Palm Springs has approximately 48,000 people. They correlate this 700% increase in the spike to approximately 5,800 people. Now, that means that there are 5,800 people on December 7th that are have active disease with COVID-19. And I'm going to show you a simple graph. And again, here's the measurements. Oops, hold on a second. I have a lot of photos here. Photos, do this correctly here. Okay, like this. And you can see, and I'll post this also, not only on Facebook, but Pharmative.com, that here's the line going over in time, and then all of a sudden on December 7th, right after Thanksgiving, a huge spike by 700%. Again, that's a signal which indicates that approximately 5,800 people are infected. Now, we know we're going through this next third wave, and we know that by looking at the number of people hospitalized, the number of people that have been tested for COVID-19 positivity, as well as the number of deaths attributed to COVID-19. And as of today, and today is December 13th, 2020, we have over 298,000 deaths attributed to COVID-19, and we have 16.2 million cases in the United States. And approximately, if you do the math, the average crude mortality rate is 1.9%. So that would suggest that if you did have COVID-19 or a loved one had active COVID-19 infection, on average, 1.9% of these patients die. Now, in special populations, minorities, Black and brown people, or people that suffer from comorbidities like hypertension or poor heart or poor lung health, the mortality rate is even higher in this patient population. So this is not anything that is false or fake. These are the facts from reputable sources, such as the CDC, of an epidemic. We know friends that have been positive with COVID-19 and symptomatic, and gladly enough, our friends have done well and recovered. But I'm sure now, with as many cases as we have in the United States, again, 16.2 million cases in the United States, I'm sure you know of friends or family members who have contracted the disease. So again, this is based on facts through the CDC. And this is why we need to take measures such as wearing masks, practicing social distancing, and self-quarantining when told to. Again, wear your mask, practice social distancing when you're outside your home, and self-quarantine when you're told to self-quarantine or told to stay home, and that's to mitigate the spread of disease. So, again, it's very important that we listen to our public health officials overall and our local public health officials on how best to minimize the spread of disease. Okay, so the second topic that we're going to talk about is something that is called herd immunity. And I have read statements from politicians and heard statements from politicians, some of whom are doctors, but obviously not well-read or well-informed about what herd immunity is, where they actually explain it incorrectly. And this diagram is actually coming to you from a very reputable source in medicine, and it explains to you what herd immunity is. And the first statement, and again, I'm going to post this not only on Pharmative.com, but also on our Facebook Pharmative page, is it states what herd immunity is. Herd immunity is when an outbreak slows because enough people are protected against the disease and the virus has fewer places to spread to. Okay? Now, exactly what does that mean? And I can best explain it to you in a diagram. So on here are figures which represent human beings. The blue figures represent those that are not immunized and are still healthy. The yellow figure represents those people that have been vaccinated or have recovered from COVID-19, so yellow. They've had the disease or they've been vaccinated and they have antibodies to fight the disease. And the red people are those that haven't been vaccinated, have contracted the disease, and are sick and contagious. So the red people are the people we really want to stay away from, because if you're healthy, you don't obviously want to be in contact with people that are contagious. The problem is, as we know, that many people with COVID-19 are asymptomatic. They don't have symptoms. They're not aware that they have the disease, but they can spread the disease. So here in the second part of this diagram is basically illustrating the fact that the disease can spread quickly when there aren't enough people that are immunized, vaccinated, or recovered from. So again, yellow represents the people that are immunized or recovered. I had a little brain fog there. Blue people are the healthy people. The red people are the contagious people. And what you can see here to the right are more people becoming red. So more people becoming infected with the disease. Okay, now here's the diagram which is going to illustrate herd immunity. Okay, we have 2 people in red, so 2 people that are contagious with the disease. We have the yellow people that are now immune to the disease. They're either immune because they naturally develop the disease and then your immune system produces the antibodies to the disease. Or artificially, they were vaccinated to produce the antibodies to the disease. So those are the people that are in yellow, and then the blue people represent the healthy people. Now, if the contagious people are surrounded by the yellow people that have the antibodies, then they can't easily come in contact with the blue people that are susceptible to the disease. So it's actually almost like a physical block. People surrounded people that are susceptible to the disease with the people that have the immunity to disease, whether that's artificial or naturally occurring because they contracted the disease. They have the antibodies and therefore they don't spread the disease. And that's what herd immunity is. If enough people are either vaccinated or recovered from COVID-19, that minimizes the spread of COVID-19. And that's what we mean by herd immunity. And it's a very important concept because we would like to, through the vaccination program, we would like to get to approximately 70% of people vaccinated. And if 70% or more of Americans are vaccinated, then that's going to really minimize by far the spread of COVID-19 in the communities. And that's the way that we're going to overcome COVID-19, overcome the complications of COVID-19, and overcome the risk of mortality associated with COVID-19. And that's the concept of herd immunity. You may want to go back and play this one more time, or after this broadcast, I will post it. You can look at it for yourself. It's actually a very simple concept. Herd immunity is a concept which is sometimes misused, but again, primarily it means that a sufficient number of people are immune to the disease, and therefore the spread of disease in the community is greatly lessened. And that's where we want to go. That's the ultimate goal in the vaccination program in the United States. So I hope that makes sense to you. I am now going to turn to the last part of this broadcast to talking about the new Pfizer BioNTech vaccine that 2 days ago gained national emergency approval. We're going to talk about the efficacy of the vaccine and the safety of the vaccine. Okay, so in the study, and you can actually Google for the Pfizer BioNTech protocol, you can actually Google it and read the study itself. It's quite comprehensive, but it's actually very easy to read. And basically it was a study of over 40,000 patients. They enrolled approximately 43,000 subjects onto the study. One of the criterias were that they had to be of a certain age, 16 years of age or older. So this was an adult study. So we don't have data in children as of yet. And they had to meet sufficient criteria in order to participate in the study. And then of the 43,000 patients that were enrolled in the study, it's a little bit more than 43,000, Half of them were randomized to receive active vaccine, and half of them were randomized to receive placebo. And then by monitoring those patients over time, they were able to actually look at the incidence of those subjects that turned COVID-19 positive in the study just by them living their lives, doing their daily activities. And they found, which was really a wonderful positive finding, that 95% of the patients were COVID-19 free of those patients that received the active vaccine. And that was an extremely high efficacy rate for this study, even beyond the expectations of the scientists conducting the study. Now, there's a similar messenger RNA vaccine that has been developed by another company called Moderna, and we're looking forward to that being approved within the next couple of weeks as well. And they have already read out their initial findings, and it's 95% as well. Both vaccines are messenger RNA vaccines. Now, what does that mean? They are not made with the live vaccine. So you cannot get the virus at all. There's zero chance of getting the virus from the vaccine. They're made with messenger RNA. What is messenger RNA? It codes for the protein. And in this particular case, and I'm sure many of you have seen pictures of the representation of what the virus looks like, it has those spikes in red in this diagram, these spikes. The messenger RNA comes into your body, and your body's ribosomes produce the spike protein. That spike protein is now seen as foreign by your immune system, which then develops antibodies to the virus's spike protein. So the minute that this virus enters your body, those antibodies are already armed for the virus to attack the spike protein. That sends off a cascade of immunological cells, different types of cells, antibodies, macrophages, and different types of antibodies, and cascades of different effect to kill and crush the COVID-19 vaccine. Now, all good news. Now, as we talked in Pharmative before, we always weigh the benefits of medicine to the side effects, and all medicines have side effects. The good news is that there are minimal severe side effects, and there are some patients that do develop minor side effects. Soreness at the injection site is one. Fever is another, which means that the fever is an indicator that your body's actually immune system is revving up to attack, to basically arm itself to attack that spike protein. Okay, and you can have not only soreness, but you can have allergic reactions, rash, and there's also now associated with the Pfizer biotech vaccine, some patients develop a severe anaphylactic reaction where they have to be monitored very closely for approximately 30 minutes after they receive the vaccine. And they can treat that with an EpiPen. So those patients that have a prior history of severe anaphylactoid reactions should discuss with their doctors and pharmacists prior to getting the vaccine. Okay. Other types of drug allergies like penicillin aren't even related to the vaccine. So that's not a concern. But those patients that have had a prior history of severe anaphylactic reactions should discuss this with their healthcare professional team before getting the vaccine. So now at Formative, what we do is we've talked about the harm that COVID-19 can cause, including death in approximately 1.9% of patients. It can cause organ toxicity, brain toxicity, lung toxicity, scarring of the lungs, kidney toxicity, neurotoxicity, confusion called brain fog, chronic fatigue, and clotting disorders. And we're still learning about the long-term complications of COVID-19. So now we want to weigh the benefits versus the risk. And in this case, the cost is going to be minimal. So we don't have to think about the cost. Patients are going to receive this drug for either free or at minimal cost. We're going to weigh the benefit, 95% efficacious. That means 95% of the people that are vaccinated will not get COVID-19. Huge benefit. Minor side effects. Okay, we just listed them as fever, soreness in the arm, fatigue, possible rash. There's a very small percentage of people that may have an anaphylactoid reaction that can be treated with an EpiPen. Okay, those are the side effects. Those are the risks. The benefit far outweighs the risk. And like Dr. Fauci, and like President-elect Biden, and like my partner Jimmy, and like myself, if I have the opportunity to get the vaccine, I'm going to get the vaccine, not only for myself to prevent COVID-19, but also to prevent my loved ones from getting COVID-19. And also because it's my duty as a citizen to mitigate, to minimize the spread of COVID-19 in the community. So when given the option to get the vaccine, if you have questions, you discuss it with your pharmacist, you discuss it with your doctors and nurses prior to getting the vaccine so that you can make an informed decision. I'm going to get the vaccine. Other people are going to get the vaccine. There'll be a second vaccine that will be available shortly in the United States, the Moderna vaccine. There'll be other vaccines. There's at least 3 others. So there's going to be a choice of vaccines to choose from. But you're more than likely going to have 1 or 2 choices based upon the distribution of the vaccine in the country. And that's when you have to make the informed decision of getting the vaccine. Get vaccinated. Vaccines are safe. And I've done actually formative episodes before looking at this, and there's very little risk to getting any kind of vaccine. There's never been any kind of linking of a vaccine to autism, as in some of these conspiracy kind of controversial websites and stuff like that. That just doesn't exist. This is a brand new type of vaccine we've never had before, with brand new technology that scientists have been working on for years, utilizing messenger RNA. It's safe, and the FDA has determined it to be safe and efficacious. So when given the opportunity, get the vaccine. We hope that there will be many different types of vaccine available, so there will be enough vaccine for all of the people that should get the vaccine can obtain the vaccine. Now, I just want to also conclude with the fact that this Pfizer-BioNTech vaccine requires 2 doses. We're going to follow the protocol and get the 2 doses. And for the Pfizer-BioNTech vaccine, that's 3 weeks apart. So you get your initial vaccine, that gives you some immunity, but to get the complete immunity and the full benefit of the vaccine, you get a second dose 3 weeks after the first dose. So that's the new Pfizer-BioNTech vaccine. I hope I answered some very basic practical questions regarding COVID-19. We discussed herd immunity. We discussed that wastewater sewage study, which is also published in full on pridenation.com, which shows that right now in Palm Springs and in other communities, we're seeing a huge wave of the virus. So you need to practice social distancing, wear your mask, stay at home as much as possible, and when you venture out, practice social distancing. And when public health officials tell you to self-quarantine, you self-quarantine, especially if you're traveling or if you test positive for COVID-19, because we know some people are asymptomatic. So that's it for Formative Live today. Thank you for joining us. I always conclude by saying stay healthy. Stay healthy and practice healthy behaviors, because being healthy, it's easier to prevent human disease than it is to treat human disease. So stay healthy, and we'll see you next time.